We deal with all sorts of traumas, accidents, abdominal pain, coughing, shortness of breath. But one thing we've had to deal with more and more over the past 10 years is overdoses. Overdoses of our children. It's a child that is the everyday child. It's a kid that is growing up in the school, he's getting A's, she's a cheerleader, they're athletic, they're doing well at home. And what they don't realize is they started to use it as an escape mechanism or as a party mechanism. Their body becomes addicted to it. And then they have to start using it weekly, daily. And then it starts to rule their lives. Typical scenario of what will happen here is we'll have a call from the paramedics that they have an incoming overdose. We don't know what it is, accidental, intentional, mixture, until they get here. We receive the adolescent in our emergency room resuscitation area. Oftentimes they're not breathing. They've vomited, they've swallowed their vomit, they've aspirated their vomit into their lungs. We end up having to do CPR, which is chest compressions, trying to get the heart to restart. We put a tube into them, into their lungs to help breathe for them. If we're fortunate enough to get them back and get a heartbeat, get their body temperature up, make sure their electrolytes are balanced, make sure they're not too cold or hypothermic, then we have to worry about, is the brain going to recover from this? Did the brain, was it deprived of oxygen too long that now they will not have a functional recovery? Then comes the part where the parents come. They walk up to the hospital, we give them a call. We don't tell them what's happened generally at this point, but we want them to come. They come into the hospital. They're usually greeted by the chaplain, the nurse, and one of the physicians. We generally ask some questions to try to gain some information of their child, because we know as soon as they realize the extent of the injuries or what has happened, they're going to shut down. Then we tell them. And it's oftentimes, it's shock, it's tears, it's crying, it's, how could that happen to my child? It can't be my child. My child doesn't do drugs, my child doesn't drink, my child doesn't do this. And again, it's a repetitive theme, it's almost like a repetitive movie. You have to find out what was the root of the problem. You can't just take the drugs away and say, okay, you're good, you're going to be fine. I think oftentimes as a parent, especially if our children are doing really well, we tend to brush off small warning signs, or we discredit them because our kid can't do anything wrong. It takes the responsibility of us as parents to really monitor our children and to watch what they're doing and notice these little things. By the time we're educating these kids, they've already started using. We can't talk to them at 13, 14, 15 years old. We need to start talking to them at 8, 9, and 10, because what we're seeing is kids are starting to use these drugs at 11, 12 years of age. Their risk of addiction, if they start using marijuana or alcohol at the age of 12 to 15, goes anywhere between 60 to 80%. Where if we can push them and hold off till they get about 19, 20 years old before they try anything, their addiction rate drops to 8 to 10%. I have teenage kids now. I see what's happened in our community alone. I've seen my children's friends being sent to rehabs, Utah, Arizona. I've seen children die who were in my community. And the fact of the drugs and the alcohol, that it can't happen to me, it can't happen to my family, is the most invalid statement there is. Because it does happen to you. It does happen to your family. Whether it's directly or indirectly with your children, it's there. And we have to just hope and pray and educate that our kids can get through this.